Good morning. Thank you for joining Consumers Doctors channel. I'm a volunteer for the Foremost organization. I try to educate as many folks I can in regard to the health, insurance, healthcare related topics on personalized healthcare, folks. Today's topic is healthcare trends. What are the new healthcare trends for 2020? There's a lot been because of the COVID. There are a lot of changes happening, and it is for a good reason. I'm sure we should take advantage of it. Let me go through one by one so that way we can all address that. For healthcare trends is number one, we are adopting more and more technologies, and that is a good thing for the consumers, good thing for the average folks, especially in the lower socioeconomic groups, and everybody I seem to have mobile phones. So the technology is on consumer side, folks. So I will be going in detail at some point later. And number two, healthcare trends is EMR, electronic medical records. When you go to see a doctor, these electronic medical records have been very antiquated for the doctor's offices. They're being modernized, and it's mobile friendly. So that's a good thing. So electronic medical records are being modernized. So that is going to be added benefit for all the consumers, and that should lower the cost of the healthcare. So I foresee better EMRs, electronic medical records. And number three, relationship with the patients. With this healthcare things as they are right now, with managed care, intermediate organizations, the relationship is not the same, folks. Doctors have no communication with patients. Basically, they are like patients, and consumers are treated like objects, not even creating. Ideally, there should be a doctor-patient relationship, like what you see, attorney-client privileges. There should be a doctor-patient relationship, and it is being improved with the new technologies. So that's a good thing. So I foresee a lot of changes in the patient relation, especially with personalized healthcare is implemented. And number four, satisfaction survey. Every time I go on to any app or if I contact anyone, immediately following the contact, they send me a satisfaction survey. So that is being implemented in doctors' offices. That's good for the consumers. Yes, it's good for the consumers. And number five, cybersecurity. That is very important in healthcare because privacy is a major issue in healthcare related thing. So what I would like to see, there's already a lot going on in cybersecurity, and with two-step verification things, and it is being more secure right now. So I would continue to see more tools for the cybersecurity. And number six, HIPAA training. Again, these are all privacy issues. HIPAA training is one of those things which is very important for the consumers, and privacy is a major. And you can be trained HIPAA basically through telecommunications and mobile technology, and it's becoming easier for people to go take some classes for HIPAA training and get certified. So that is being that should also, again, cybersecurity is a regulation. We need to follow it, and I encourage everybody to follow through the HIPAA training and get certified. Number seven, price transparency. Yes, very critical. Price transparency. Price transparency in insurance industry, in hospital facilities, in doctors' offices, lab services, laboratory services. So those are all critical. Patients or consumers need to know what the bill is going to be. So it is changing slowly, but I think I foresee a lot of regulation and price transparency coming up from next year. Hospitals have to be price transparent, and I foresee even ultimately insurance companies have to be price transparent based on the categories, not general risk pool, folks. One of the reasons the insurance companies are not able to give the prices because the risk pool is so vast. We need to categorize the risks. So insurance companies have to be transparent. All the lab services need to be transparent. Physical therapy, rehab services, CAT scans, imaging services, they all need to be transparent. They need to know how much the consumer's bill is going to be before they get in. So that is coming. That's going to be. And number 8 is, as you know, telehealth. Telehealth is already here, and actually it's good for the patients, good for the doctors. As a matter of fact, I see telehealth is going to benefit the doctors because overhead expenses for the doctors is over 40 to 45%. By with telehealth you can lower the overhead cost, and as a matter of fact, a lot of physicians are about to retire. They already want to get into telehealth. So that way, most of the senior doctors want to stay at home and see the patients online through telehealth. And Skype, you name it, Skype, Google Meet, Zoom, all this technology, you can be literally be in front of your patient and analyze and make a diagnosis. You will need 20% of the patients need to be examined and all that. I understand all that, but there is a trend. There is a trend towards and number 9, wearables. When you talk about telehealth, wearables is a big thing. Now you can do an EKG with a device. You can have a echo with a device, echocardiogram. Wearables are here to stay, man. Wearables are something which is going to be a tool which should lower the cost of the healthcare delivery. I foresee a lot of wearables coming up already, and me being a urologist, we have so many gadgets I can come up with through wearable technologies, and it's a bright future ahead, folks, for doctors and consumers. There are a lot of wearables coming up, and you can monitor them remotely. And number 10, healthcare marketing is going to change because right now the insurance companies are not being transparent. I foresee once you have a personalized healthcare with 4 segmented risk pools, they have to be transparent, and healthcare needs to be open and competitive, including the facilities, doctors. They have to be transparent. It is medical, mergers, medical group mergers, hospital mergers. That is slowly, it's going to be a downward trend, folks. Unfortunately, that's not going to. There has to be more competition in healthcare, not consolidation. So I see a lot of competition in healthcare, and I see the medical groups are ultimately will be dismantled because I don't think there is you need to have overhead cost be billed to the consumers, because anytime you set up a medical group or hospital mergers, there's a tremendous cost in intermediary cost. I'm talking about intermediary cost. So I think the more diverse, more competitive it is, the price will go down. So there has to be a price competition too. And number 11, vendor compliance. All these vendors who bring all these new gadgets. They have to be compliant and to the healthcare. You know, they have to go to. They have to be approved, and they need to be monitored. So vendors have to be compliant. Those days of companies taking out doctors and bribing the doctors for the to prescribe, those days are gone, man. So those are, you cannot bribe a doctor for medications or certain tools to be used, and if it's made aware, they're going to be fined. So all these companies and vendors have to be very careful with physicians, and they have to be transparent. And number 12, outsourcing. Hospitals, doctors, insurance companies, they're all outsourcing in their own fields. So that should reduce the cost. And this so-called the new technologies are being outsourced, and they're coming up with, every time you turn around, there's a new technology on the market. And number 13, health inspections, which I concur. I have no problem with health inspection, but they don't need to be, they don't need to end up in choking the doctors and hospitals, making their life difficult. I understand, you go to these grocery chains, they're being monitored. All these groceries, food industry monitors them very, they do a good job at it, and it should be comparable to the food industry folks. Just because you belong to a health category, patient safety is important. It is quite important, but you can do these health inspections like what you do for these grocery stores, restaurants. They're all inspected on a regular basis. They should be the same. I don't see any difference between inspections of grocery chains and physician offices. Hospitals, I understand you need to be a little more thorough, and hubs, so-called hubs, provide outpatient services. They need to be thoroughly inspected. Number 14, non-compliance, no showings. Patients don't show up. Those things now with electronic medical records and telehealth, if a person makes an appointment for a doctor's office or on telehealth, they're automatically charged. So question of no showings, non-compliance needs to be fined. People are non-compliant, there has to be consequences for no showings and non-compliant patients. So there has to be consequences. Otherwise, it becomes it's more of a liability for doctors, patients, and it's for a doctor especially, it's liable. And when you don't take care of it's your responsibility for your patient health. And that's where we need to have a tort reform, and where we need to have rewards need to be limited rewards. And I want to see healthcare professionals get involved with juries. I don't want average folks. There is no emotions involved, folks. This is something to do with how you take care of your patients. Healthcare professionals, don't tell me the healthcare professionals are emotionless. No, but they know the facts. They know because they have been in healthcare. I think they make a better jury. I get all these jury calls. I wish they call all these nursing professionals, healthcare professionals as a separate entity for healthcare issues, and they should be called for a jury like anything else. And number 15, department communication in the front end and the back end. I'm talking about doctor's office. There are better communication tools nowadays. This is a problem in the medical group setting, but I don't think individually, when you're doing telehealth, telemedicine, and you're a solo office, one person or two physicians, the communication is not a problem. Only when this problem arises in the medical groups, and that's why one of the reasons why I don't foresee any bright future for these groups. They need to be dismantled, and that keeps going up because they are considered as intermediaries, like managed care organizations. Managed care organizations are the one who created this so-called medical groups, and these managed care organizations need to go away, man. These are intermediate organizations. I see bombarding with ads for your Medicare dollars. All these insurance companies, they want to say free this, free that, no copays, free dental, free eye checkup. You know why they're doing that? They want to make money from the federal dollars. So that power has to be given to the consumers, folks. Consumers are in the front line, and invest in that money into the consumers rather than intermediary organizations, giving it to the full risk contractors. I see several doctors taking full risk contracts. Doctors are there to provide the, Hippocratic oath, man. If you're not following the Hippocratic oath, you're not a doctor, you're a business guy. I see doctors taking full risk contracts. You should just get out of medicine and be a business guy. And don't take full risk contracts from Medicare. And you claim to be a doctor, but at the same time, you're trying to chip away the services. It's not right. This is not ethical for doctors to be taking full risk contracts. All these medical groups are taking full risk contracts. That's not ethical. And its leaders are the physicians in that groups. So I would like to see some changes in that. Precision. Healthcare is more precise. I'm a urologist. I do robotic surgeries. I've done robotic surgeries. Precision is becoming so critical in technology. Precision, especially in surgeries, is becoming a vital thing. Anything, even coming to the healthcare delivery, it's all precision. It's documented, and this so-called EMRs, it's every time you have an interact with a patient, it's already documented, folks. I don't know. We need to seriously look at, do we really need to have a paper documentation? We need to look at that. And number 17, mobile phones, man. And you're able to document your communication. You're able to record your communication with your doctor. You're able to record communication with your patients, hospitals. Everything is documented. So do we really need still paper EMRs, electronic health records? We need to see how that works out, because HIPAA violations, if we can preserve those video records, it itself, they have to follow the HIPAA. That's what it is. 19. This is very important. Mental health. It's a chaotic mental health, especially has been so chaotic. I foresee a lot of changes in mental health. This is where personalized healthcare it's really helps people with mental health, because they're not getting the right care. And AI, virtual doctors, and virtual psychologists, virtual psychotherapists, these are all coming, folks. Do you really, for mental health, they need to be seen in the clinic. You can be AI can make a diagnosis. I'm telling you, the technology is out there. So we need to use it and take full advantage of the AI in mental health. I want to see 100% of the people with mental health needs to be taken care of, personalized, and they have to have a certificate of guaranteed coverage, and they need to be addressed. We cannot neglect them. And if I see anybody neglecting a mental health, and they should be liable for that. I think I foresee a lot of liabilities if a person is neglected just because he doesn't have a health coverage, or he doesn't have. See, personalized healthcare will resolve all those issues related to the mental health, and there is going to be state and federal funds which will be available in providing the care. So I think this is a very important thing. The last 20, this is not be taken lightly because I'm a physician and a lot of physicians are going through a burnout. Too much rules, too many regulations. They let me go. I've been practicing, I've been urologist for 35, 40 years just because of whatever, one family member complained to the California Medical Board. They say, okay, you need to go. I said, fine. I would like to thank that family member or patient, whoever complained to the medical board and let me go, lose my license. I would love to thank her because doctors are very hardworking people. They're innovative. They can come up with alternatives, man. There's no other profession like physicians are very independent, loving people. They're the way they chose medicine because it's a gratification, folks. This is one patient family member complained. I understand, I'm a human being, folks. I cannot make everybody happy. I'm sure. And if that woman or family member was listening, thank you because they let me go. And you know what? Who's really having the problems with this? Because more and more physicians are getting burnt out and they want to retire because it is not like having a good doctor-patient relationships makes you happy, gratification. Nowadays, physicians in this managed care environment, they're burnt out. They're working more hours, getting less. Something needs to be done, folks. You cannot have. I have no problem. If the California Medical Board is listening, thank you for letting me go because that gave me more opportunities. And I love it. I love my retirement, man. I love it. Again, I'm a volunteer. I work for a nonprofit organization and foremost organization, DBA, Consumer's Doctor. I am the Consumer's Doctor, guys. We will see you in the next episode of Consumer's Doctor. We will have fun. I have no doubt. I want to see the comments from you guys and I want to make it interesting. I would love to see comments coming back from the audience. I'm still having how to, maybe one of these days I'll be able to see the comments coming in so I can talk about it. My experiences in healthcare. I'm proud to be a doctor, even though I cannot practice in California. That doesn't mean I cannot practice anywhere else. But I don't want to because they by having less physicians, basically healthcare industry is hurting. They're being penalized for simple things, folks. And if you let a doctor go and retire, who's going to suffer? The patients. I love my patients. Patients used to adore me. My weakness was I used to listen to the patients. I followed them. I loved them to death. But if one of the family members is not unhappy with me, it's fine. I have done my duty. I'm very happy with my. I'm passionate about healthcare access for all Americans, but healthcare, so-called California Medical Board, I know you're under a lot of pressure, but you need to go easy on doctors. You can for a simple. I know everybody's watching you and you're under the gun. You have to do your job, but you have to look at the overall healthcare industry. We need more doctors, we need more nurses, and more people are retiring because they're getting burnt out, man. So these are the healthcare trends. I'll continue to address them. And if you guys have any questions, do call me. I'm available and send me an email or be on the chat box. Do subscribe. Don't forget to subscribe and hit the bell. Hit that bell for notifications. Thanks again. We'll see you next time.